Sundari Mace, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County for today. As of April 22nd, we have 192 cases of COVID. That's 10 new cases since yesterday. They're largely due to our contact tracing activity that we've talked about in the past. Of these cases, 103 are active, 87 have recovered, and we still have the 2 deaths that we've reported. We've done 4,699 tests so far. So before I begin, I would like to update you that we have received shipment of swabs, and we do expect to receive another 100,000 swabs in the next 2 weeks. So we are going to start priority testing. We'll have a drive-through testing event this weekend. We are going to stick with the CDC priority groups. So the first group of people that we intend to test are healthcare workers, both symptomatic and asymptomatic. We'll start with the symptomatic healthcare workers, and then we'll start with the asymptomatic healthcare workers. Then we're going to request that symptomatic first responders be tested. Then after that, we'll move to symptomatic people over age 65. The next group to be tested will be those people that are working in essential businesses, service providers. So for example, those people that are working with the utilities or with the court system. And then the next group will be anybody in the community who is symptomatic. And we will provide some surveillance testing for asymptomatic people in the community as well. So we'll let you know when it's your turn to call to get an appointment for the drive-through testing that we're setting up. So now, for the topic of the day, we're more than a month into the shelter-in-place order. Social distancing and shelter-in-place is definitely working to flatten the curve. But of course, it comes with many challenges that can leave people feeling depressed, anxious, unsettled. So it's really important for you to take care of yourself during this difficult time. So just a few tips on how you can do that. You can eat a balanced and varied diet. Make sure that you include plenty of fruits and vegetables, whole grains, plant and animal proteins, healthy fats like nuts. Make sure that you sit and eat mindfully. In other words, turn off the TV and everything else with a screen while you're eating. Stick to a routine. This might include a regular time to work, eat, or exercise. Stay hydrated. How much water we need depends upon age and activity level. But remember to drink throughout the day and keep a water bottle or glass ready and next to you. Move. Physical activity benefits both your body and mind. Adults should aim for at least 30 minutes and kids for at least 1 hour of daily physical activity. Take regular breaks from sitting by standing up and stretching. Think outside of the box. You can pursue all kinds of activities, gardening, dancing, playing with the kids. This all counts towards physical activity. Prioritize sleep. Try to get 8 hours, go to bed and wake up at regular times. Exercising and limiting alcohol can improve your sleep. Make sure you're getting your information from trustworthy sources. There's a lot of misinformation out there on the web surrounding COVID-19 and also on social media. It's important that you get information from trusted organizations and government websites. SoCoEmergency.org is the best site for your latest local up-to-date information. It's important to stay informed and limit watching the news that might cause too much anxiety and might impact your mental health. Stay connected with others. Although we talk about social distancing, we really need physical distancing. We want you to be emotionally connected to your family and friends. You can have a video chat or a phone call with friends or family. Share how you're doing with others. If you're feeling alone and you need to talk to someone out there, you can use a number of ways to connect with mental health resources. You can find these different resources on SoCoEmergency.org. Also, starting tomorrow, you can call the County Mental Health Warm Line at 707-565-2652. This free and private warm line service is available 7 days a week from 10 a.m. to 7 p.m. Local behavioral health professionals will answer the calls 7 days a week to talk with callers to provide support, guidance, education, and any referrals that are needed. So now we'll go to our questions, community questions. One question we got is, why are we not testing more people? Well, we are going to start testing more people. You can find information about that soon. We'll be sending out information on how we're increasing our testing, as I just described. We will start this Saturday. The other question is, when will we have more modeling? We expect to have more modeling data later this week, and we'll share it with all the public at that time. Well, thank you very much for joining. Take care of yourselves and stay healthy.